All of us worry sometimes about what other people might be thinking about us, but social anxiety is more than just, do I look good in the outfit I'm wearing, or did what I just said sound okay? This is the sort of thing where a person gets to worrying way more than they need to about what would other people think about me with what I'm doing or what I'm saying or with how I look. What would my parents think, or my son or my daughter or my friends think of me if they ever knew some of the things that are going on? Social anxiety is not just being nervous about giving a talk. It's being worried way more than most people are or need to be about what other people would think about me if they ever knew. Sometimes it's specific people. You know, it's my parents or my friends or my husband or my wife, people that I work with. But in some cases, it's just others, anonymous others, other people. And worrying about what other people on the street or that I see in the grocery store or they're in the restaurant with me might be thinking about me. Social anxiety is a problem that a lot of people struggle with. For teenage kids, it's about 11% of girls and about 6% of boys who have it. But the numbers change when you look at people who are past their 17-year-old, you know, say the 18 and up range. There it's about even 12 or 14% for both males and females. But the thing that's striking about this social anxiety is that though there are many people who have these difficulties, only half of those affected ever seek treatment for it. This is a problem that causes some serious difficulties for some people. The impact of social anxiety can be seen, for example, in a much higher rate of dropping out of school, of not being able to go on. Some don't finish high school, or some will start or not even be able to get into doing any college, and they've certainly got a higher rate of unemployment. As a result, often you find that they have an increased percentage of remaining single and a higher rate of getting divorced. So what causes this? Well, it's partly genetic. It runs in families. First-degree relatives are 2 to 6 times likely to have the same problem. But it's not just a matter of the genetics. It does run in families, but the fact is there are also environmental things. Now, another thing that happens often, and it begins to start early with a lot of people who end up getting a social anxiety diagnosis, and that is that sometimes their friends, even when they're in school, don't want to bother with them. They don't seem to have some of the social skills that most other kids have. Let me mention a few different things that seem to go with this. One thing has to do with the kids who are really early or late in their pubescent development. But those who are especially early or especially late often are likely to have more social anxiety because they worry so much about how they look compared to other kids. Are they a lot smaller than the other kids walking down the hall in high school? Or are they a lot bigger than the other kids? Is their pubescent development slower or way faster than other kids? There's an increased likelihood of this in LGBTQ people, where they tend to run into negative reactions in school and their families. But the thing which is puzzling to a lot of people is that sometimes social anxiety is not just about how I look, how I dressed, or what I've said, but even about what I'm thinking. There are many people who struggle with the thoughts that they have in their mind that they think would be shameful if anybody knew. But what happens as a result, often people who start with social anxiety end up with a more generalized anxiety disorder, or specific phobias, or OCD, or mood disorders. And among those who have social anxiety disorder, about half of them develop a whole history of panic disorder. The lifetime rates of depression for those with social anxiety range from 35 to 50%. And among the people who struggle with social anxiety, dependence on drugs or alcohol is anywhere, depending on which study you look at, 2 to 5 times as likely. So what I'm trying to suggest is that social anxiety is a problem that is not talked about very much, but it's something that can be helped if a person is able to seek help. It can be helped with some psychotherapy, it can be helped with some behavioral treatments, and it can often be helped with medication. Hey, thanks so much for watching. If you found this video helpful, We have a lot more content like this on our channel, so make sure to subscribe. By doing so, you can help to further Understood's mission, which is to make sure that the 70 million people with learning and thinking differences like ADHD and dyslexia can thrive.